Without doubt, the key word characterizing 2020 is coronavirus. The COVID-19 outbreak took China by surprise, but immediately China regained its footing and started to fight, determined to win. In Chinese philosophy, as applied to governance or even to warfare, there is a clear distinction between what's called the Tao, or the guiding principles, and the Shu, which means specific strategies and tactics. In China's war against COVID-19, the Tao, the overall principle, is that people's lives matter most. In other words, the number one priority is to save people's lives. In human rights language, China says that it means the right to live is sacred. As a result, the CPC and the government resolved to pay all costs related to the epidemic, everything from testing to treatment, all hospitalization. There was no limit. China's containment of the coronavirus exemplifies CPC governance and brings us closer to China. In China's war against COVID-19, the overall principle is that people's lives matter most. As the first country to encounter this devastating pandemic, how did China respond? In this episode, the medical assistance team from Peking Union Medical College Hospital looks back on their days on the front lines. Also, Professor Zhang Weiwei shows how the CPC leads, organizes, mobilizes, and coordinates the Chinese people to fight the virus and win the war.
By now, we could say that China has achieved the general success of the war against COVID-19 epidemic. Under the leadership of the CPC, led by General Secretary Xi Jinping, the party has united the whole nation and successfully contained the spread of the epidemic and turned China into arguably the safest country at this moment in the world. Just comparing China and the United States, for instance, by the end of May 2020, this year, the confirmed cases of COVID-19 in the USA was 20 times higher than China, and the death toll in the United States is 22 times that of China. This decisive and impressive record is inseparable from the party's powerful capacity to lead, to organize, to mobilize, to coordinate the Chinese state and society.
It was an ordinary consultation day at Peking Union Medical College Hospital, but for Zhang Shuyang, the hospital party secretary and the leader of its medical assistance team, and for every other medical worker who rushed to the front lines of Wuhan, this is the first normal day they've had in months. Since the beginning of 2020, China has been engaged in a war against the novel coronavirus disease COVID-19 outbreak, a major public health emergency that has spread the fastest, been the hardest to contain, and caused the most extensive infection since the founding of the People's Republic of China in 1949.
我们在这儿过年，你们却在帮我们过关，但是
如此艰辛。
On Chinese New Year 2020, a reunion night for Chinese families, more than 1,200 medical workers across China were drafted to aid Wuhan, including the medical assistance team from Peking Union Medical College Hospital.
北京协和医院
We sent 186 medics in 4 batches to assist in Wuhan. The first team, the earliest supporters, arrived on January 26th, the second day of the Lunar New Year. I remember it vividly as we had been called up while celebrating the holiday with our families. Our team was the last to leave Wuhan. A third of all the medics we sent over came from the departments of infection, respiratory and critical care medicine. There were experts from 17 specialist areas, as well as cardiology and nursing care, which formed elite teams. The 4 teams were put together in 24 hours and sent immediately to assist in the ICUs at Tongji Hospital. All 6 temporary party branches assembled at the front line, and they put up a good fight as well.
China is a vast country. We have 1.4 billion people, which means roughly the size of 100 average European states put together. And you need a core leadership to have people united to fight for a cause. In this case, to fight against this virus. And as you know, when I look at this scene of this particular hospital, their staff helping Wuhan and Hubei, actually that's a scene we saw in most of time during February, March, and even April, early April, in different parts of China. I was in Shanghai that time. We saw similar scenes in Shanghai. Party members volunteered to go to the frontiers. And this is important because as a member of the CPC, you are supposed to, really know what it means to be the spirit of self-sacrifice for the cause of the country, for the cause of the Chinese people. From the very beginning of this fight, General Secretary Xi Jinping outlined strategy. Point 1, be confident. We are going to fight this war against the COVID-19 and we are to win, which means decisive leadership, which is crucial for the success of this fight.
All you need to do is to be confident. We will win this war against the epidemic. Wuhan will win, Hubei will win, China will win as well.
Indeed, when we have decided to save life as our top 1 priority, there's no time to lose. Speed matters most. As a result, we reject categorically what's in the West called herd immunity. It's inconceivable in the Chinese culture. We respect life of everyone, from the youngest to the eldest. We have to save their lives, so no time to lose. So confidence is crucial. We reject defeatism, reject herd immunity. The point 2 is be united. As we know, as we all see, over this period of a few months, China as a nation have united as one. We help each other, we help Hubei, we help Wuhan, and over 42,000 medical staff from all over China were dispatched to Wuhan, to Hubei. And CPC members are among the first to volunteer to go to the frontier. So this is very crucial. In the Chinese philosophy and Chinese culture, we have this saying, when one place is in trouble, help will come from all quarters. And this is manifested very well in this whole process.
Over half of our team was made up of party members upon our departure. That number surged to 74% on the way back. 52 healthcare workers requested to join the CPC while fighting the virus. It was the first time the hospital's party committee has had to handle such applications in peacetime since the establishment of the PRC. Even a day after arriving to Wuhan on January 27th, 3 medical workers submitted CPC applications. We had to facilitate measures to accept these applications on the front line.
Sun Chuefeng, Associate Chief Physician of the hospital's Department of Pulmonary and Critical Care Medicine, is one of the first 3 medical workers who applied for admission to the party before going to Wuhan.
I left for Wuhan on January 26th and didn't return to Beijing until April 15th. Sometimes we joke that we went through 81 challenges during those 81 days in Wuhan. I was born in 1978, and I feel my generation differs greatly from today's youth. We have witnessed China go through great change. Over the past couple of decades, the country has become more prosperous and people's pockets have deepened. Around 1997 to 1998, when I was still at college, I met a lot of people who aspired to go to the US, a symbol of freedom and democracy. People dreamed of going overseas. 10 to 20 years later, things started changing. My classmates who went overseas are returning to China, a testament to our country's tremendous change. Such a transformation was realized under the CPC's leadership. I always had an urge to join the CPC, but I didn't feel like I was up to their standards. When I went to support Wuhan, my mind was changed. Seeing medical workers from around the country gathered in the city, I was impressed by the party's strong cohesion. Over half of our team were party members, and I was inspired by their initiative and spirit, which in turn inspired me to serve the country better. So on the second day after my arrival, I submitted my application to join the CPC. This cup was a gift I received during my stay in Wuhan. On it reads, "To heroes." I actually don't think we're heroes. We just did what doctors are supposed to do. That being said, the 81 days I spent in the city were incredible. I use this cup every day, so I won't forget Wuhan.
Sung Kai Chung, Director of Cardiovascular Anesthesia in the Department of Anesthesiology, is also a member of the 2nd National Medical Assistance Team to aid Hubei Province. He also served as Secretary of the 5th Temporary Party Branch established in Wuhan.
We spent 79 nights in Wuhan. At 8 p.m. each night, the party branch would organize a meeting to review the cases of all patients, discuss treatment and departmental cooperation in depth. The party committee played a critical role in bringing the people together to fight the virus. Sometimes we were humbled. There were patients we failed to save despite all our efforts. Once, I tried to help a patient in the span of 24 hours, but didn't manage to save them. The frustration was immense. This patient was someone's family member. A family had lost someone who was part of their memories.
So now they can generate.
Despite setbacks and suffering, China states it has contributed generously to the global fight against the virus. Since the early days of the outbreak, China states it has been transparent, sharing developments in detail and with clarity. However, some have ignored this information, even blaming China. China states that while those intending to malign will easily find a pretext, far better is global cooperation to contain the pandemic and defeat the virus.
In China's cyberspace, we have a saying, China was the first to encounter this test. It's like an examination, and we write our answers. If only the United States could follow and copy answers, you could have done 100 times better. Unfortunately, for one reason or another, they failed to copy the Chinese exercise, Chinese answer. They tried something from their own under Donald Trump. Today it proved to be disastrous. As in any given major event, not to mention a war, without the leadership of a leading corps like CPC in the case of China, it's inconceivable you could really stage this kind of war and win it. If you compare China with other countries, you will see why so many countries failed and failed completely, because they don't have this organization or leading institution which can organize, mobilize, coordinate, and lead the state and society. So China's experience of this fight proved the value of the party's leadership. And indeed, we treat this as a war. We have to use the language of warfare. I would say perhaps we have fought the 3 types of wars in the whole process of fighting the disease. In the first place, it's a war of containment, which means immediately, as soon as possible, we try to contain the spread of the disease. It's by no means easy as a city of close to 10 million people, but we did that in the interest of the whole nation and the human and world community. And for other parts of China, it is first level emergency response. So by then, China became really a clear-cut 2 battlefields. One is Hubei and Wuhan, and the other is the rest of China. It's really a test of the CPC's competence in leadership and in commanding competence.
Workers in Wuhan with heavy machinery racing against time to build a brand new 1,000-bed hospital in just 10 days.
Yes, China has announced that they're building a 1,000-bed hospital in just 10 days. 10 days to build a hospital. There is no other country that can do anything that fast. Like in America, it takes longer than that to get cable installed.
And the second type of war is what we call an all-of-state war or all-of-nation war, which means all major institutions have been involved in this fight. If you look at the what's called the Joint Working Group for this fight under State Council, it's made up of 32 government institutions, from airports management to public service, to hospitals, to universities, to the People's Liberation Army. And this system has gone down throughout the Chinese state infrastructure, from central government to local government, provincial government, municipal government. It's all coordinated work. So it's a test of the CPC's competence for coordination. And then it's a people's war. And we have a principle, it's called the one for all and all for one, which is crucial. In many ways, this had to do with the mobilization capacity of the Chinese Communist Party and the Chinese state. We provide information through this. Fortunately, we have this WeChat revolution at first time and first hour down to every Chinese citizen, and people know what time to take what actions. People know we should self-quarantine, we should cancel dinners, we should cancel other engagements. Don't forget, this lockdown took place on the eve of China's Spring Festival. So as a result, many dinners, parties were cancelled immediately. Otherwise, you could think of, disastrous consequences as the disease would spread fast.
By no means did all work well. There were obvious obstacles at the start of the outbreak. A strong top-down system is effective at stopping rumors, but how can it undermine bias and reduce vitriol over virus origins and actions and increase mutual understanding?
The CPC is a party with a strong tradition for learning, and from the very beginning to now we re-examine the whole process. We always think that in certain parts of our fight, something could have been done better. Since 2003, when SARS broke out, China set up a system, what's called the reporting system, from grassroots to the central government if there is a contagious disease. Yet at this time, because this is a unknown virus, it's something novel and new. But this reporting system, it's only reporting the known disease, known viruses. So this is something which, when we look back, it's regrettable. And also, as with other countries, public health is important, extremely important. But when we re-examine the whole work of the public health in China, we could have improved the system much better. As you know, as everywhere, hospitals prefer treating patients, curing patients, because that's the market economy. When you cure a disease, and public health is more about prevention. So prevention generates less income. So this also was something that we should re-examine and try to overcome whatever loopholes in the Chinese system of public health.
There is no denying we made mistakes during the initial outbreak due to lack of understanding of the virus. But we corrected those mistakes in a timely manner, unlike some Western countries. Thanks to the strong leadership of the CPC, we implemented good policies diligently and promptly. Chinese people have faith in their government. After Wuhan was placed under lockdown, people there stayed at home, and medical workers volunteered to join teams already serving on the front lines. Many citizens have contributed from their own pockets. In contrast, people in Western countries are reluctant to cooperate with their governments. They have little faith in them, or they link them to conspiracy theories. Thus, cooperation there doesn't work well. Social distancing, as it's called, wasn't fully enforced.
Wuhan provides hope for the rest of the world that even the most severe situation can be turned around.
As medical assistance teams risked their lives at the front lines, local residents in Wuhan were doing their part to pull the city together. It was a long 3 months, but as the city gets back on its feet, it's time for the hard-working volunteers to look back on what many would call a job well done. Wang Zhixiang and his team of 17 worked tirelessly to deliver supplies for more than 70 days.
It's so worthwhile to see the smiling faces of medical workers. As long as our contributions can relieve the pandemic, it's worth it. When we gave the flowers to the medical workers, it was a priceless moment. It just feels so good when you can pass love on to each other.
The team began by sending medical supplies. As shortages of protective gear were resolved, they started to deliver food and snacks. The donations the team gathered from around the world benefited more than 1,700 hospitals and communities.
I am a local Wuhan resident. If I do not support my city, I will feel guilty. I hope that I can help relieve public anxiety. I have to contribute as much as I can.
As an entrepreneur, Wang Zhixiang focused on profits and business ties, but the pandemic changed his views.
We've survived the pandemic in Wuhan. I feel there's nothing more important than what we've done. During the pandemic, we only thought about one thing: how to help others, how to help others, and how to help others. We thought about how we could thank those donors, how we could give back to those who have helped us.
Wang says when the pandemic ends, he'll continue pursuing his dreams with more respect and care for others.
During a visit paid by General Secretary Xi Jinping on March 10th, he addressed the people of Wuhan as heroes. My heart welled, having reached out to many of the residents there. A community named Phoenix, situated behind the hotel we stayed at, was home to several hundred households. The 20-odd-story high-rise is brightly lit at night, but during the day you never saw anyone outside. Imagine how they survived all that time. Our driver, Mr. Zhou, a retired soldier, was always punctual. Every day he would park the car at 10 minutes to 8 and depart at 8 a.m. sharp, not 1 minute earlier or later. It was like clockwork. Given our shifts, he'd drive us 6 or 7 times a day. He was never late. One day, however, he didn't come to pick us up. It was later that we found out his father had passed away due to the virus. We had no idea his father had been hospitalized until after his death. We thought he would be away for a few days, but he only took 1 day's leave. The next morning, as usual, he was waiting for us at the hotel 10 minutes before 8. We were deeply moved seeing him there. At this moment, I am particularly grateful to the people of Wuhan. They are great.
The people of Wuhan made great sacrifices in the battle against COVID-19. They are tough, and I was deeply touched by some of the things they did. For example, our nurses took 4 shifts, with 4 hours per shift, so they needed to commute at 1 a.m. or 3 a.m. between hospitals and hotels. Our drivers were never late. They were all volunteers. They never even earned a penny. Cooks, cleaners, security guards, hotel staff, all of them were volunteers who would work around our schedules, awake even at 3 a.m. This is the spirit that ensured the triumph of Wuhan.
A major crisis is a litmus test of a ruling party's governance philosophy and governing effectiveness. The COVID-19 global pandemic is the most extensive in a century. All political systems have trade-offs. Regarding this test, the CPC faced it and passed it. CPC General Secretary Xi Jinping stressed, "Our greatest advantage is that under our socialist system we can concentrate our strength on major undertakings. The party can effectively recruit and focus economic resources and organize and mobilize social forces to implement massive national projects. Almost 40 million CPC members fought the virus on the front lines, including more than 13 million CPC members who volunteered their services. After weathering the pandemic, the Chinese people broadly appreciate the CPC's leadership in the face of surging disease. Many Chinese say their trust in and support for the party have increased, along with their confidence in China's political system. That's closer to China."